Dear students, today we will discuss a on-table finding, how it looks like. An emergency situation. See that suction tip is there. It's a laparotomy wound. You can see stomach, there is a hole here. See that hole here. See that hole? So nothing that perforation. So this is gastroduodenal perforation. Mark clearly says. So gastroduodenal perforation either in the stomach or in the duodenum. It's quite common. It shows gas in the diaphragm. There are three stages, remember. Stage of chemical peritonitis, stage of elution or recovery, elution it is, and stage of bacterial peritonitis, that's more dangerous. So these stages are important. It's the main question also for you. So how it is clinically diagnosed? They will have sudden severe onset pain. Then later they will have a guarding rigidity, tenderness, rebound tenderness. Then eventually on percussion in the flank, free fluid will be there. And the liver dullness will be obliterated. It's very important. If you check the liver dullness, it will be obliterated. So that shows gas under, clinically you will say gas under diaphragm. So obliteration of the liver dullness is very hallmark of the perforation and gastroduodenal perforation also. Other causes of perforation you have to remember: jejunal perforation, mainly trauma; ileal perforation for typhoid and malignancies; and colonic perforation, again colitis, acute megacolon, volus, sigmoid volus, or necrosis. All these things are the different causes of the, or any area goes for a gangrene, that will perforate. Hernia may go for gangrene and perforate. Interstitiation may eventually, once irreducible and cause of necrosis, may perforate. So anything, vascularity is gone, then it may perforate. Here it is the typical gastroduodenal perforation. So X-ray is diagnostic, CT scan is the ideal investigation, and acute immediate resuscitation with the fluid aspiration, catheterization, maintaining the IV fluid, starting antibiotic, placing the central line, then emergency surgery is required. Per midline incision is placed, then perforation is identified, all fluid is sucked out, infected fluid pus, then perforation is closed using 2-0 silk suture usually, or 2-0 Vicryl polylactin. After placing a omentum, 3 sutures are placed. 1, 2, 3. 1, 3 you have to put first, next middle one, last middle one you have to put after placing the omentum. That is called Cellar-Jones technique. Grams are little different, where you close the perforation, then put the omentum. That is modified Grams operation. So different types are different names. Cellar-Jones is commonly used. So all these in detail about the gastroduodenal perforation is the main question for UGC and PGs. You can always go through my stomach chapter and understand the technique, different classification, when scoring systems are there. So how to identify everything, clinical features, all those things are very important. Liver dullness obliteration, X-ray abdomen, erect post, X-ray chest, remember, not a chest abdomen. Chest X-ray with the upper abdomen in erect posture. Understood? Not chest X-ray abdomen. The diaphragm should be covered. So chest X-ray with the upper abdomen, you should tell. In erect posture, gas under diaphragm will be there. So that is the investigation. Of course, CT is ideal. Electrolytes, blood count, blood urea creatinine, LFT, urine output measurement, maintaining the urine fluids, resuscitation, surgery. Then place a drain and close the abdomen. Then further management post-operatively is also very important. That is exactly, this is the perforation. See that all those things I have already told, Cellar-Jones technique, and see that this is the perforation closed with the silk, interrupted suture. 3 sutures interrupted after placing the omentum. Then only close the perforation. Don't close initially. That is Cellar-Jones technique. And read my book for perforation, stomach chapter. It will give every detail about that. SRB manual of surgery. And basic X-rays you can go through my SRB clinical methods in surgery also. So students, answer the MCQ. Bowie scoring is used in A, B, C, D. Write the correct answer in the comment box, and I will appreciate your and acknowledge your answer. I will put the right answer later. And second answer MCQ is modified Grams operation is A, B, C, D. Go through this right answer and put it in the comment box. I will really acknowledge your right answer and put the right answer later. And so for that, please go through my SRB manual of surgery and SRB clinical methods of surgery for detailed explanation of clinical examination of the acute abdomen and also stomach gastroduodenal perforation as such. And also I will request students, please go through my YouTube channel and other channels, website channels for case studies, instrument brief discussion, and operative procedure discussion briefly, and image studies, and of course at regular interval live sessions in the presence of senior faculties, where clinical cases are discussed live with the proper interaction with the students for entire period of where long cases like in the exam discussed as like in the exam. Quotation of the day is, your nature is your future. So how you behave, that is will decide your eventual future as such. That is the quotation of the day. Students, please go through my SRB's Manual of Surgery, very popular book all over the world, and my Clinical Methods in Surgery with the video lectures supersedes all other clinical book with the proper information. Everything is covered with the videos, instruments, specimens, basic orthopedic, and also operative surgery briefly. So everything for the clinical side, for CBME syllabus or practical point, it is very, very useful. And my operative surgery, Atlas of Tissue Approximation are very popular books. And please subscribe my website, YouTube, Instagram website for further knowledge and daily regular knowledge. And my digital lectures are there for 220 hours through JP Publishers. For 1 year, you can always purchase and have increase your surgical knowledge, because everything is covered, including your specialties, every general surgery, gastro surgeries, basic operations, instruments, everything as per CBME syllabus for UGs and also for PGs, basic information it gives everything. Digital lecture for 220 coverage is very, very useful for you. Please, you can purchase through JP Publishers. So please subscribe again requesting my YouTube channel, which is free. SRB Surgical Insight QR code is here. So students, I hope you understood this gastroduodenal perforation very well. Thank you so much.